Imagine waking up to headlines shouting that the government has shut down. You might immediately worry. Will my Social Security check stop? Will my Medicare coverage disappear? Or will Medicaid services suddenly end? These are real fears that come up almost every time a shutdown is in the news. So let's break it all down in plain English. No political spin, no scare tactics. Just the facts about what really happens during a federal government shutdown. Every year or two, you probably hear about a government shutdown on the news. It sounds dramatic, and in some ways it is, but it doesn't mean everything stops. A shutdown happens when Congress and the President cannot agree on a budget or spending bill. Without new funding, certain parts of the government are forced to close temporarily, but essential services, like air traffic control, military operations, and emergency medical care, keep going, often with staff working without pay until funding is restored. Because programs like Social Security, Medicare, and Medicaid are lifelines for millions of Americans, it's natural to worry about them during a shutdown. These programs are crucial for seniors, people with disabilities, and low-income families. To understand why they usually keep running, you need to know how the government divides its spending. Federal spending falls into two buckets. The first is discretionary spending, which Congress decides on each year and covers things like national parks, government research, and many federal workers' salaries. The second is mandatory spending, which is written directly into law. Social Security and Medicare fall into the second bucket, which means their funding does not rely on yearly appropriations and continues even when the government shuts down. This is why Social Security checks still go out during a shutdown. They're paid through the Social Security Trust Fund, not the annual spending bills. However, while the benefits keep flowing, some services can slow down. New applications may take longer. Replacing lost Social Security cards could be delayed, and call centers might have fewer staff. People already receiving benefits almost never see an interruption, but those starting new claims or making changes may have to wait a little longer. The same goes for Medicare. It's also a mandatory program. Hospital insurance under Part A is funded through payroll taxes, and Part B is financed through premiums and general revenues. This structure keeps the program running even when the government shuts down. But, again, some administrative work may slow. Processing new enrollments or appeals could take more time, and non-urgent paperwork may back up. If you already have Medicare coverage, your doctor visits, hospital stays, and prescriptions should continue without interruption. Medicaid is a joint federal-state program. Most of its operations are handled by states, and federal funds flow automatically without needing a new spending bill. This means Medicaid generally keeps providing coverage and services during a shutdown. However, if a shutdown lasts a very long time, states might experience delays in federal reimbursements. That can cause budget stress for state governments, but rarely affects beneficiaries directly in the short term. Even though benefits and coverage usually continue, a shutdown still creates ripple effects. Customer service at Social Security or Medicare offices can slow down. Disability hearings or appeals may take longer to schedule. Call centers may have fewer staff to answer questions. Public outreach programs may pause. It's like a restaurant staying open but running with only half its staff. The core service is still there, but everything moves slower. So the bottom line is this. A government shutdown can feel scary, but essential programs like Social Security, Medicare, and Medicaid almost always keep running. Your benefits are unlikely to stop, though you may notice delays in customer service or new applications. Understanding how federal spending works, discretionary versus mandatory, can help you cut through the noise and stay calm when you hear those headlines.